Hello, good evening. How are you? How are you day? Welcome to another session of Ask the Doctors. My name is Dr. Frederick Unubohai. People call me Dr. Fred Dostar. And I always tell you good life na sin. Now, this program, I be the host of the program. My co-host na Dr. Israel Robonose. And this program holds every Sunday by 8 p.m. Nigerian time. Every Sunday is a 1 hour program. Now, today's program is a question and answer session. Question and answer. So, we'll be taking your questions today. Any question you have for us, you can drop the question and we'll try our best to respond to you. Before I continue, Happy New Month. How are you? Happy New Month to you and your loved ones. I am live on Facebook. I'm live on Facebook. I'm also live on YouTube. I'm also live on TikTok. Before Dr. Israel comes, when Dr. Israel comes, would end the TikTok live. But for now, I'm live on Facebook, I'm live on YouTube, and also on the other platform. Happy New Month. How are you? Where are you watching me from? Where are you hearing me from? What is the time over there? Talk to me. Yes, good evening. So today we are taking your questions. If you have any question for me, please drop your question on Facebook or YouTube, and I'll try if I can respond. We'll try to respond to you. But please remember, we don't give our number on this program. I know they give number. I know they do private chat with anybody. So if you're trying to get my number so that you will call me, sorry, I know they give my number. If you're trying to private chat me, sorry, I know they private chat anybody. But if you have any question right now and you can hear me wherever you're watching me from, drop your question and I will try to respond. Okay, you're watching from where? Watching from Cameroon. The time is 8:02 p.m. Okay, I see you. Good evening. How you day? People on TikTok, how far? Okay, now those really watch me for Facebook. Ask me your question, I beg. Ask. No time, no time, no time. Oh yeah. Before Dr. Israel comes, if Dr. Israel come, then we go end this TikTok live. Yeah, man. Okay, good evening. Alice, I see you. Let's see. Now I noticed something. The day where I go they teach, where we go get topic, people go come, go they ask you questions we know they related to that topic. So let's say last week we're talking about vitamin C. Somebody go they ask me about blockers, about Ebola. You understand, right? Hey. Now, so ask your questions. Watching from South Africa. Okay. Manford Fury, watching from South Africa. Precious, I see you. Somebody is asking, how far does ovarian cyst affect fertility? Yes and no. Not in all cases. Please don't ask me for medicine here. Oh, I won't give you medicine. Oh, don't come and be asking me for medicine to treat you on my live session. I'm sorry. Oh, I no go prescribe medicine for you. Shey dey hear me so? Why you dey laugh? People on TikTok, why not they laugh now? I miss you. Hey Esther, how far now? Honor Esther, how you dey? Okay. Please, no treatment here. I beg you. Okay, let me see. Oriyomi, good evening. Happy New Month. Yes, from the United States, Chicago, Illinois. Yes, how is the United States now? Yeah, Doctor. Good evening, Rachel. Dr. Solomon, Dr. Kelechi Solomon. Happy New Month. How you day? Oh yeah, now. Somebody is watching me from Liberia on TikTok. Another person is watching me from Belgium on TikTok. Gold is watching. He says, I enjoy your videos. Thank you for enjoying my videos. Yes, like I was saying, the day where I go to teach maybe about hypertension or hepatitis or something, somebody will now come and be asking me question outside of the topic. Now, ask your question. Make I see whether I will go fit answer you. You know, go ask. Number two, Please, oh, I don't give my number on social media, no matter how much you beg me. If you like, use everything in this world to beg. I know you give my number, oh, eh? I know they private chat anybody, oh. Sure you understand? Okay. Thanks for your service to humanity. God bless your hustle. Amen. Oh, people on YouTube, Bella. Bella is watching me on YouTube. Bella, how are you? Iniobong SCN is watching me on YouTube. Yes, Iniobong, how are you? Vivian is watching on YouTube. Vivian, how are you? Now so. And then people on Facebook, I see you. Oh yeah, ask me your questions. Huh? Ask. Let's go. Let's see. Watching from Port Harcourt. Kingsley Ogbonaya is watching us from Port Harcourt. Okay, I did this before. Question outside topic. No. Please, what is the cause of loss of sense of smell? Loss of sense of smell. When your nose, when your sinuses, when they are blocked, when they are tensed, when they are full, you might not be able to perceive because there's a connection between your brain and your nose. So if you have an infection around that area, it might delay you smelling. You understand? Or if you have a problem with the part of the brain that controls smell, you might not be able to smell. But if the problem just started not quite long ago, depends. Most time people tell you that whenever I have catarrh, whenever I have cold, I'm sneezing, you don't smell, you can't perceive because it's blocked. So you try to do steam inhalation, you support your body with multivitamins, with fluids, vitamin C fruits. It can help you. Yes. Somebody is asking me what causes sore throat. The video is on my page. If you ask me any question that I have made a video about, I will let you know. The video is on my page, sore throats. And for those who are watching me for the first time, you're welcome. My name is Dr. Frederick Unugbohai. I'm a licensed medical doctor. I try my best to educate people on social media, most especially in pidgin English, so that you can understand. Please, I beg you. I don't private chat anybody on the internet. I don't give number. I know why I'm saying this. So that in case you're watching and you're like, guy, I want to call you. Can I have your number? Sorry, I will just ignore that comment. No vex. You understand? Yes. Somebody says, I know they ovulate. I come go see gynecologist. They can't say make I run 3 tests worth 79,000. And I don't get the money. I beg, no other means to make me ovulate. So, Alice, when your gynecologist tell you may you go do tests, they are trying to find out why you know they ovulate. You get many reasons if you make woman no ovulate. So you don't want your doctor guessing, because most times when patients go to the hospital and doctor just tell you go and drink medicine, you dey vex, you no do test. You dey vex, you no do test for me. Why? So how do you know what you are treating? So your gynecologist wants to know what is happening, what will be the cause of your problem. Now I make them say make you go do test. There is no way I can tell you to go and boost your ovulation when we don't know what is causing your ovulation. Do you understand? That is it. And then if there's anybody you can ask what you can take, is your gynecologist. Is not on social media, because we will just scatter your body on the internet. Nobody understands your system better than your doctor. Yeah. Good evening. If you're watching me on Facebook, please share this video. Share the live session. Share. If you're watching me on YouTube, click on the like. Click on this like button, share, and invite your friends. Kelechi Esther, good evening. Somebody's asking me what causes sore throat. The video is on my page. What is causing low sperm count? I have made a video also on low sperm counts. Dr. Israel is here. So I'm going to bring up Dr. Israel to the platform so that we can ask our question as well. Dr. Israel, if you are ready, just give me thumbs up and I'll bring you up. Okay. Dr. Israel, Alpha, if you are ready, just give me thumbs up so that I'll bring you up. Okay, Dr. Israel can't hear me. Somebody's asking me what causes low sperm count. Many things can cause low sperm count. Plenty things. Plenty. Number one, maybe your body is not producing enough sperm. maybe your hormones, your testosterone, is not producing enough hormones so that your body will produce sperm. Number two, maybe you have issues with your testes. You understand? The testis is the organ, is the powerhouse for what? For production of sperm. So if you have a problem with your testis, it might also be one other cause. Some men can also have what we call antibody. The antibody, they react with their sperm, they destroy the sperm like that. So when a man say he get low sperm count, sometimes too, now the lifestyle of the man, some men get poor lifestyle. And when we tell them, Oga, try to exercise, try to stop smoking, try to stop alcohol, try to eat healthy, take balanced diet, and the rest, they will tell you, say, forget. I know somebody where they smoke and we they take alcohol. The person don't bump picking everywhere. So I beg, don't talk to me. Not knowing that different people's body respond differently to certain chemicals. So there are many things that can make a man have a low sperm count. I just touch on them. Now, if you have low sperm count, your doctor will want to do or carry out so many tests on you to find out what the cause of the problem is. It's not enough for you to just go to the lab and do tests. Oh, my test say I get low sperm count. So you don't go do tests, but you need to see your doctor so that your doctor will help you. Yeah. Okay. If you never share this live session, share the live session, share the live session, share the live session. How are you? If you're asking me questions on TikTok, you have to come to Facebook. Please, my niece has a very strong odor. My niece has a strong odor, mostly from the under. Please, what could be the cause? I can't tell you what could be the cause of the odor now, madam. I have not seen your niece. If a woman, a female, get odor under, many things. Is it hygiene? Is it infection? Do you understand? Is it a reaction? Many things can cause it. So we have to find out when this thing starts. She get discharge, she get pain, she get fever, wetin she don't use. We can't diagnose you on social media. Oh, that is one thing I want you to know. So if you are here thinking that I'm going to make diagnosis for you, it's almost impossible to diagnose you on Facebook because I don't know, but it might be an infection, it might be poor hygiene, or it might be another thing entirely going on under that we need to look at, that we need to examine. Yes. Okay. Good evening. Good evening. Happy Sunday. Watching from Lagos State. Somebody is asking me, what is the cause of hearing loss in teenagers? No, teenagers don't have hearing loss. What is your name? Vivian. Teenagers know they get hearing loss. When you say, what is the cause of hearing loss in teenager? Anybody can develop hearing loss. Maybe trauma. Trauma. Maybe somebody don't go knock on for ear, or maybe you don't go put something for ear, or you don't go they exposed to loud noise. Share this live session, please. Maybe you don't go they exposed to very loud noise. The loud noise don't affect the eardrum. Maybe in cause am. These are some of the things which make somebody get hearing loss. Either trauma, then hit them for ear. Maybe you put something inside ear. You're exposed to loud noise. Loud noise destroy the eardrum, maybe. Or maybe you don't get chronic infection for the ear. We don't affect the connection between the eardrum and the brain. Do you understand? Yeah. Okay. If you're watching me on TikTok, you have to come to Facebook so that I can take your question. What causes bleeding inside the nose? The video is on the page. I have made a video on nose bleeding. I don't do video on nose bleeding. I don't do video on sore throats. I don't do video on many things. So if you are just watching me for the first time, you can go to my YouTube or Facebook. One thing that can make you have nose bleeding. One, there are many other stuff. You can find it in the video. One is trauma. If you use your hand, they pick inside your nose. You can injure yourself. You can have nose bleeding. Another one again. Let me just give you another one again. When the weather the weather is very cold, when the weather is very cold and dry, You can have little cuts in the nose and you have nose bleeding. Now, I mentioned something again in the video. I need to go and watch it. If you are having bleeding from the nose, you are not supposed to bend your nose backward. People will tell you that when I'm bleeding from the nose, I have to bend my nose so the blood will not come out. It's wrong, oh. It's very wrong. So please, go and look for the video on my page. I have made over 800. Is it 800? Let me try to be moderate. How many videos I don't make, Seth? Let me see. How many videos? I don't make plenty videos. Some are on YouTube, while some other videos are not on YouTube. But let me see how many. Okay, on YouTube, 620 videos on YouTube, but there are so many of them not on YouTube. So maybe 800 or 900 videos. Okay. Share the video, share the video, share the video. Good evening, Samuel. Please, I want to know if a CS mom who has done 3 CS do the fourth one, what are the implications? Implication is that no implication if your doctor carries out the procedure very well. So if you meet a good expert that knows their stuff and they do the CS for you, no implication. But sometimes some women will tell you that after they carry out CS, after they had a cesarean section, they are noticing pain, little pain. For some other women, no issues. Oh, they are very fine. Depends on the body. One, the woman's body. Number two, the technique, the skill of the doctor. Your doctor that is treating you, that did the CS for you. Many things. Yep. Okay. Are you sharing the video? Now, the people on TikTok, you will have to come to YouTube and Facebook so that we answer you. My name on Facebook, Dr. Fredosta Official. You will spell the doctor in full, Dr. Fredosta Official. You will see me live on Facebook. Dr. Israel, your network is not moving. No, Dr. Israel, your network is not moving. What's happening? Okay. Dr. Israel, somebody's asking me, waiting fit give person energy apart from energy drink, Efe. I'm going to tell you one, but when you watch my video on energy drink, when you watch my video on energy drink, I mentioned how to get energy. So a lot of people, they take energy drink because they won't get energy. But rather, you supposed to find out waiting they make you not get energy. Is it that you are stressed? Is it that you are not resting well? Is it that you are not eating well? When your body is overstressed, my guy, your body go tire. But instead of you to give your body a break, make your body feel rest, get energy back. Now, lie, you dey go take energy drink. Let me just say it again. Energy drink will buy you. So one advice for you here. The other ones did the video. Go watch them more. You did YouTube, you did Facebook. Go and watch the video on energy drink. I mentioned a lot of things there, but I didn't post all the videos on TikTok. So my videos on TikTok, I will never post complete video on TikTok. Now waste of content on TikTok. But if you are following me on YouTube and Facebook, you will always see all the complete videos. Yes. So rest is one way to get energy. Another one again is eating. Chop food, eat food. Person know they chop, they complain why they get energy. Why? No be magic. I sometimes I think this generation, this generation is full with hypocrites, and I'll tell you why I say that. Doctor will advise you, rest, eat, sleep, leave all these things. You go say no, or no. I won't do them. When doctor can't try to help you, when you don't spoil your body, can't give you medicine, you'll say no. The only thing we na sabi na medicine, na medicine, so that they make money. Now we are giving free advice. Do these things so that all these things go out and leave you. Say no, I beg, I must smoke, I must take alcohol. No verse. But when all the problems come, they can't try to help you. They give you medicine. Not say you go they insult them tomorrow. Say now only medicine then sabi. Do you understand? Okay. Somebody is asking me a question on YouTube. Dr. Israel's network is not networking today. I can't bring him up. Dr. Israel, your network is just messing up. I don't know why. Dr. Israel, waiting they happen. Your network they seized. I know they see you. Somebody says, I have blood pressure. No, you have high blood pressure. Your network they seized, Dr. Israel. Waiting they happen. I have high blood pressure and I am on medication. Let me see if I can bring you up. Dr. Israel, Alpha.
I'm fine. They hear me?
Hello?
Can you hear me?
They hear you. They hear you, boy. They crack. How far? Yes, they hear you.
I'm fine.
Okay. Okay. How you doing?
Good. Happy Sunday.
Yeah. Happy Sunday. Happy Sunday to you. Okay. Welcome. I believe they hear me. So somebody they ask question. It says, in day on medication for high blood pressure. You want to know if this medication, if this drug is for life. You won't ask. You won't know. But before you answer, I beg. I won't ask this person. I beg you. Who give you medication for high blood pressure? Because whenever a doctor prescribe medicine for a patient for high blood pressure, we dey always add other advice together. Is it that they no tell you, or them tell you, you no one listen to them, or you just go buy medicine for high blood pressure? That is one. Number two is that, okay, Dr. Israel, please respond. I beg, respond.
I think we need to get that response when you ask the question when you ask, so I will even still know how we go still and cancel the person joiner. So we will know whether yes now hospital actually give am the drug, or you go pharmacy or chemist go buy the medication. Because I have noticed that most people, once they go chemist or pharmacy go check their BP, they notice say they high. From there, they all buy medication and they will start to take them. So I think it's good make we get response from that person before we talk the next thing when we will need to talk. Or I think just talk everything together.
Oh yeah, now go ahead. But no. Maybe we'll find out first. We'll find out. You get why? We'll find out. So that make we advise them well. We'll advise them well. Yeah. Okay. Yes. If you are watching us, this is Ask the Doctors every Sunday by 8 p.m. Every Sunday, 9 with a day here. Me and Dr. Israel. We don't do one for 5 years now. This program every Sunday, 8 o'clock. Today, we will take your questions. Ask us anything. We will try answer you in the next 1 hour. When it gets to 9 p.m., we are done. Somebody they ask us, I beg, share this video, share the live. He says, please, is it advisable to shave one's private? Is it advisable to shave one's private? Okay, Israel, you want to respond to that?
Yeah, it depends on the individual. If you know, say when you shave, you don't have reaction, you shave. But it's always very good you shave to because sometimes when that place don't get many bush, many hair, it can actually hinder your hygiene to some extent. Mostly when after you don't go urinate and all that. Mostly for female, after you don't go urinate and all that. Drying the place may not be too easy, and because of that, it can lead to one thing or the other. So it is very important. It's very good that you shave. But if you can't be say you know the person when be say anytime you shave, they get serious reaction. I will advise that you even go see doctor on that regard, and they also know what to do. You feel not going to shave completely, but you will still get the best, so that you can actually get the best.
Yes. And in addition, again, make I add something. So those on TikTok, I'm sorry, I'm leaving the live session on. Normally, I'm supposed to cut them because you can't hear Dr. Israel, but let me leave it like this. Make I add something too. For people where they shave, you need to know how your hair be. Some people, their hair they very soft. When you shave, they get problem. Some other people, their hair is strong like iron, like metal. If you they shave, they do as if you want scatter somewhere. You understand? So you need to know the texture of your hair. If your hair be like stone, like it too strong, you should not shave down to your skin, because if you shave to your skin, you feel develop bumps. You understand? So you need to understand also the texture of your hair and other things. But these are a few things that can help you, and also the advice Dr. Israel gave you. We have a question from Martins. I have a lump beside my rib. What could be the cause? Hey God, I beg you. Okay, so Israel, I beg, answer.
If you get lump beside your rib, you want to go to the hospital. They go want to find out that lump if they pain you. They also want to know if they grow or if not they grow, and how long that lump don't dey there. And they want to know whether they move or you just dey there. And also they want to find out if you get any other kind of swelling like that, or any kind of lump for any other part of your body. So with that, they will be able to detect what it is, and they may even want to do small procedure for that place to remove the tissue, to go and test, to go and do histology for it. So now with that histology, they go really know what that lump be. And sometimes if na still boil, they go still know from there. If they pain you, if they cause fever, they give you fever and all that, and you dey touch and they dey like say na water na dey inside or na pus dey inside, that can just be boil. But if it not be like that, you need to see a doctor, make them for examine that lump very well. It's very important that you do that, so that make them know what kind of lump be that, whether na benign or na malignant lump. They go let you know. When we say benign, we say something will not go to cause you problem. When we say malignant, we mean something when feel lead will be where they cancerous. Yeah.
Okay. Thank you, Dr. Israel. Now, because of people on TikTok, see, oh my God, if you see that they support me, we get enough gadget here. You get her for connect them so that we're not for the here, but no vex. So Dr. Israel said that making go hospital, number one, they go check the lump to know whether na benign or be na cancer. Whether the lump they grow for size or you just dey there. You get some people, something go dey their body, the thing no go grow, it go just dey like that for years. You get some other people, they get lump for body. The lump start last year. It don't they grow, they increase in size. So when you go to the hospital, these are the things your doctor will find out. This is why we can't diagnose anybody on social media. Now, before I continue, everybody, share this video. One way to support us, one way to encourage us, one way to make us know that at least we did try. Now, when you share this live session, if you want to sponsor this live session, you want to sponsor this program, there's a mail on the screen. Send an email. You want to sponsor? Yes, thank you very much. Okay, let's take another question here. Please, everybody share. That is how to support us. So all this, God bless you. Without support, no good. Okay, please, doctor. Elevated follicle stimulating hormone and luteinizing hormone, as I told you last session. I have cyst period now. Okay, I think this person was asking last week. I think yes, Kelechi Esther. So you did a hormonal profile. I remember you saw your doctor. They placed you on medication. Your FSH is high. Your luteinizing hormone is high. Your period is not flowing. This is the update. Okay, Israel, anything we want to talk about this?
Dr. Perry, answer. As far he asked the question since last week, I don't think I remember, but I think you get a little idea of it. So just
okay, yeah. So waiting I go on find out from you, Kelechi, because we talked last week. What exactly is your diagnosis? What will be the cause? Because if you get a high FSH and LH, something there will feed the cause waiting then tell you, you understand. Now, in addition to that, I know say they try to conceive. I don't know how long you don't they try to get belly. How long this events don't they go? Is it something you can wait, keep trying and trying and trying and trying? You get some people, they don't drink all the medicine for this world. They don't drink, my dear. Nothing happen. change. Some people along the line. Now, one final thing where I want to talk again, because most women, I don't say another question on hormonal imbalance. Hormonal imbalance, they take time to go. So sometimes, they just go immediately. You need patience, you need follow up. If you date for country way good, where the health system they work well, the government can support you. Your treatment no go dey too expensive. But if you dey treat country where we say government no send you, you are paying from your pocket and the rest, my dear, it can be very expensive. So I need this update from you. Yes. Okay. Somebody's asking us a question. Please, what can one do to treat gut issues? What can one do to treat gut issues? What do you mean by gut issues? Gut issues is not an issue. Gut issue is nowhere. Eh? gut issue is not a complaint. Not a what do you mean by gut issues? Gut issues are more than 100, my guy. So many issues affect the gut. So what exactly are you talking about? Yeah, man. For the people watching us or listening to me on TikTok, sorry, I can't take your questions on TikTok because I have a guest on YouTube and Facebook. If you want me to take your questions, please move over to YouTube or Facebook. We'll be able to. Though there are so many questions here, but I can't. I'm sorry. Yeah. Okay. We have a question.
Okay. That other. Sorry. Before you take the question, that man, the person who asked the BP question, he never still give the reply for us to know.
That person will ask us about BP. No, he never give us response. So
yeah,
he never give us. You want answer? You want talk? Go ahead now.
Yeah, let's just answer it so it will not look as if we did not say anything about it.
Oh yeah, go ahead.
Okay. Yeah, for you when they take BP medication and they find out if you go take them for life is it depends on yes. Let me just say yes. So you may likely take it for life, but that now depend on your relationship between you and your doctor. So if you take the drug very well, your doctor can actually tell you to. Your doctor can actually tell you to it go just tell you what to do. If now the one when they say you go continue to take am every day, or if now the one when you go they take an alternate day, it depends on how you take your medication and how your BP be, whether it still dey very high or if it dey normal. So know that the normal BP now, okay, traditionally we say 120/80. So anything more than that, if they consider and say it don't they go up. So if it's 140/90, that already go up. So once your BP is like that, more than once, more than two, say yes, is up. And now left for you, if your doctor give you medication, you need to take her every day as it is tell you you take her. And so your doctor supposed to tell you to come regularly for checkup. Now with those checkup when you go they attend, now you go to know whether you go increase the dose of the BP medication or whether you go reduce the dose. So if the BP they better, it may reduce the dose and tell you to still continue to come for checkup. So now just like that. So you go actually take your BP drug for life, because BP hypertension as at now is a non-communicable disease and it not get cure. Hypertension, diabetes, even stroke, all those things are not communicable disease and they not get cure. We only feel manage them for now.
Yeah, thank you, Dr. Israel. And in addition to that, there are some people, if they follow the advice where their doctor give them very well, and the BP can't go down to normal range, now you and your doctor will decide, will discuss. Your doctor will come tell you, say, okay, for so time, maybe you go stay away from the medicine, make we see whether it go up or it no go up. This decision, now you and your doctor go take them. But if you don't follow the advice where your doctor give you, you just do your thing, your BP will continue to remain high and you go they take the medicine. They go. Make I appreciate somebody. Somebody sent 50 stars. Godwin Bosse. Godwin Bios. How do you pronounce your name? Bios. I can't pronounce that. Biose. Bios. Godwin Bios, thank you for the 50 stars when you sent for Facebook. God go bless you. The other people, no great share. Okay, Dr. Israel, let's take this comment here. I have a supplement which contains 5-methylfolates. Can I add folic acid 400 international units to it? Okay.
Okay, can I add folic acid 400 to? You'd already get something that contain folic acid, so you really don't need it again.
Yeah.
Except you want to take that one and you leave your supplement. That's when you now decide to take your folic acid. So if you have a supplement that contains 5-methyl folate, which already have folic acid in it, it's just a derivative of folic acid. So you don't need to come to take any other folic acid in addition to it.
Yeah. Thank you, Dr. Israel, for that question. Okay, now some people are watching me on my second Facebook page. I get one Facebook page, 400,000, 480K followers. I get another one, 45K. So some people are watching me under the page that has 45K followers. I see you too for there. Some are watching me on the one with 480. Some are watching us on YouTube. Some are watching us on Dr. Israel's Facebook. Wherever you're watching us, drop your questions. We will try answer you. But the questions are much. Okay, let's continue. Let's try because of time. Hello, sir. What is the cause of pain in the right side of the head and ears? God, I beg you. Dr. Israel.
Okay, and what I didn't hear you. What is the cause of pain in the right side of the head and ears? Please. Well, many things will cause pain for the head and your ear. Sometimes if the ear gets issues, it even leads to pain in the head. If you be saying that, even they cause the pain when you feel for head, because it can also come like headache. So you need to check your ear. And sometimes if you get ear discharge, ear injury, maybe you go chook something for your ear, all those things, a problem with the eardrum can actually still cause that headache. So sometimes the headache can also be the one affecting the ear, like a migraine headache and all that. Stress and all that can also cause it. Or maybe you hit your head somewhere, or somebody hits your head with something. All those physically cause those kind of pain. So you need to think which of them be your own case, and then if now your ear, maybe the ear they pain you well, they scratch you, you need to see an ENT doctor where they specialize for ear, nose, and throat. So that when you see that doctor, you go actually look inside the ear.
Dr. Israel network don't cease. Hey God. Okay. Maybe you go try come back. So Rashidat, just like how Dr. Israel don't tell you, follow the advice, MC and ENT. Especially what's the cause of pain in the right side of the head and ears, right side of the head and ears, they affect you for ears. Sometimes it might be an ear problem where they affect you for head. The ear is connected to the head, the brain. You get how your ear go they pain you like this, you go they feel like inside your head. So there's a connection. This is why you go good make somebody see your ear. Now, in addition, make I add, I beg. If you there among the people where they watch me right now and you they put so many things inside your ear, they clean your ear. May you not get ear problem or we go come affect you for your head. Be careful, avoid it, I beg, so that you no go get problem with your ear in the future. Okay, share this live session. People are not supporting us while like a lie. People are not showing love on this page. I swear, people are not showing love. Now only God. This way they do so. Don't worry. Okay, somebody is asking a question. What is the cause of congestion of mucus at the back of the nose? I can't bring the catarrh from my nose, but through my mouth, because the mucus is so thick. Felicia, I'm just going to give you an advice here. I don't know why you have that, but take more water, take more fluids. Take more fluids, take more water. I'm not saying you should go and finish 1 gallon. No, no, no. That's what I'm saying. Take more fluids. If you get more fluids in your body go fit help you make the mucus soft. That is one. Number two, may I give you another one? And that one, this is just advice, please. I'm doing this in case somebody else too they listen. You can do steam inhalation. Boil hot water. That steam. Try cover your face and inhale it. This is an advice. I'm not treating you here. I'm not your doctor. You understand? So that people will not say, make I go tell me give me medicine. I know they treat online. You understand? But I'm just trying to give this to you to see maybe it will help you. If it help you, make the mucus disappear. Now, if you always get mucus every time, is it that you stay for environment where they make your body produce too much mucus? Maybe your environment they too cold or dust or this and this. So look for those things around you where they trigger the mucus. Find them. But if you know, say you don't do all these things and it's still there, please carry your body. Go and see your doctor. Good. If you want to sponsor this program or you want to do a sponsorship on my page on social media, send me an email. Yes, I can say this with all confidence. Send me an email. The email is on your screen, drfredostar@gmail.com. Make sure what you want to sponsor, what you want to promote is legit and it will be of value to my followers. If what you want to promote on my page no go benefit my followers, honestly, I no go do it for you. I no go do business with you. But as long as what you want to promote will benefit my followers, fine. Send me an email. We'll discuss business. But if you no go benefit us, no vex. Thank you very much. Okay. Let's see. Let me take so many questions are here. Jesus Christ, my God. Let me go back. Oh God, those see questions. I have been treating infection and it keeps coming back. Chuku Emeka, I don't do video about recurrent infection. The video dey YouTube, it dey Facebook. I dey try make videos, make people understand. My videos well. So you never watch them. You get many reasons why you go dey treat infection and you go dey come back. Number one, now you dey treat yourself. Number one, maybe now you they treat yourself and not your doctor. Number two, your doctor treats you. You no complete the treatment. Maybe. Number two. Number three, maybe you don't get resistance. Maybe. Resistance means that the problem the body. No medicine they work again and again. Number four, maybe now you they go play with the infection every time. After they treat you finish. It just be like after you don't bath finish, you don't clean your body, you go enter inside poto again. I'm listening the possible causes. I'm not saying this is why you are having it. You understand? I don't know your condition. I don't know you before. I'm just giving you possible reasons why this might be the cause of recurrent infection. So if now you they treat yourself, carry your body, go hospital, let the doctor see you. Maybe you get resistance. Or maybe they are treating something else and they are not treating the right thing. So you get many reasons to why person if you get infection and they go. And if you dey Nigeria, most times people they like treat themselves first. Now when you don't come hold them for neck, when you don't come hook them, you don't tire them, they will come hospital. That time the problem don't tire wrapper for their body. Ngozi Amina, how are you? Ngozi, I see you. Yes, shout out to Ngozi Amina. Yes, Ngozi, I give you shout out here. You deserve it. Who else do we have here again? Sisi. Sisi is on my page, so I will answer you because you are the one, Ngozi. So Ngozi is asking me a question on TikTok. There are some people, if I see them anytime, any day, they ask me a question, I'll go answer them. So Ngozi is among them. So you're asking me on TikTok. So because of you, I'll go answer you. Don't worry. How can one get water out of the ear after taking a bath? If you bath and water enter your ear, patience. Turn that ear and stay there. Give it time. The water go try come out. But if your ear wax, they very, very thick. The water will enter the ear, it will give you problem, it might not come out. So go and watch my video I made about how to clean the ear wax. Especially for those people whose ear wax is very, very thick. You understand? Go and do that. It will help you. Yes. Okay. So let me go back to YouTube and Facebook. Oh my God, please, what makes somebody not to hear with the right ear? What makes somebody not to hear with the right ear? Maybe the person get problem with the ear now, the eardrum get problem, or there's blockage in the ear. You get how your ear wax will be very thick. You might not be. Dr. Israel, can you hear me now? Give me thumbs up. Can you hear me now? Your network, okay, let me bring you back up. Okay. How far? You hear me, Abby? Hello? Hello? Hey God, the network. So now the people that are watching me on TikTok, I'm sorry. When I blow, when I big more, I will connect my Facebook, YouTube together so that you can hear everything. But for now, you can't hear Dr. Israel. So I never blow. That is why I'm praying to God I go blow. Good evening. Okay, let's see. Somebody's asking a question. What is the cause of quick release when you dey make well? What is the cause of early you dey release too much? Let me just give you two of them. I think I have made a video about it. It's on my YouTube. One, now your mind they play with you. Some men, their body they always shake. That if they enter because they go release quick. So anytime you enter there, you go release quick. There are some men like that. Number two, some other men they don't go drink things to make them last long for bed. Some of them they take TM, some of them they take codeine, many things, Brantashi, and so many of them. We know all this name now. I don't want to call all of them. Now, if you take all those things, time go reach one day, you know, go work for your block also. Your block also go stand anymore. Because they look you like that. That is one of them. You know, go feel last. You will just enter, you don't throw away. Fine. I said two. Well, let me give you one more. It's plenty, my guy. Plenty. One more. If you are severely stressed as a guy, if you dey very stressed, you no go feel last inside kpekus o. I know when I talk about kpekus, people they talk, why you calling kpekus? If you know you are carrying your face on my page when I call kpekus and you are forming holy, come up for here, please. I'm not your pastor. I'm talking about medical stuff here, please. If you are severely stressed, my guy, you no go last oh. So as a man, you need to ensure that your body they very rested, well rested, and many other things. Now, there are other medical conditions. You get sicknesses too. If they do man, if he make and no feel last inside Bekus. Hope you know Bekus and Blockos are the biggest industry in the world. Somebody's asking a question. What can cause anemia in an adult of 70 plus? I have made a video on low blood. I beg, watch the video. It's plenty. Nobody should have anemia. Nobody should have low blood. But if you're having low blood, many things can cause low blood. Many things. Sometimes it might be benign, small thing, no serious. Sometimes it can be serious, can cause low blood. Now, let me say this. There is one bad habit where people they do. People where they lick sand, unzu, clay, calabar. I'm going to make a video on that. I never get time. Do you know that if you are licking calabar, that thing can give you low blood? Yes. People where they lick calabar, clay. Some people are addicted to that stuff. They buy them, they chop them like food. Which that they tell you, I'm not telling you story. I have seen it, not once, not twice. I don't see him. This person won't scatter my brain. We were thinking. Waiting they make this person get low blood. Everything is okay. Everything is fine. The blood was very low. Until this person say, okay, make I confess. Make I no go buy. I dey leak this thing. Oh. My family no know. I dey leak calm severely. God, now we put hand for head. They have to give this person blood, 3 units of blood. I come beg him. I beg, leave him. No, they leak him. I'm not saying that's what this person have. I just have to add it here because I remember now. So if you they leak unzu, calabar, clay, you they play with problem. Oh, don't worry. When I have time, I go make a long video explain all the problems if it happen to you. Maybe say if care is not taken, you go suffer. And if you suffer, you know what will happen. You go spend money. And when you spend money, you go cry. And when you cry, you go clean your eye. When you clean your eye, you go suffer again if you no stop. Good life. Now sense. Okay. Oh, Salobo, I don't tire. Oh my God. Good evening. Watching from England. Make una share this video now, eh? Una know they share this video. Una know sabi share, eh? Oh God, I beg. Never see. Okay. Oh, the doctor prescribed the medication for you. Okay, we have answered you. Okay, no problem. Take the medication. Follow your doctor's advice. Your blood pressure will come down, eh? What can cause high blood pressure at early age of 25 and above? Many things. Lifestyle can cause that. Lifestyle like alcohol, smoking, certain medications can cause that. Sometimes you might not even know. Sometimes family history can cause it. Obesity can cause that. Problems with your body. People can have kidney problem. It can cause elevated blood pressure. People can have issues with their hormones, can cause elevated blood pressure, and plenty other stuff. So, yeah. This question: does tramadol have side effects? Ozo Chiemele, tonight, I want you to promise me something. I'm going to edit one video on tramadol. It's about 4 minutes tonight. I don't record them. I'm going to post the video tomorrow on YouTube. I'm not going to answer you. I'm going to keep you in suspense. I'm going to try to edit the video. But one promise you must promise me. If I post that video, hope you go share. Hope you go share. Nobody say I go stop and do video. You know, go support me, eh? Yes. So I'm going to edit the video this night and I'll post it tomorrow on Facebook. Watch them all. Yes. Tramadol can spoil your life. Hey, all the people taking tramadol, you are hiding yourself. You don't know that problem can enter your body. Okay. So I'm gonna post the video tomorrow by the grace of God. Yeah. Somebody suggested that a young girl should be washing her kpekus with cloves and cinnamon water and drink the water too. My question is this. I learned that nothing should get there except water. Oh baby. Oh baby. Why are you putting things inside kpekus? Why? This idea of everybody is looking for what to put inside the kpekus to clean kpekus. If you have a good hygiene, wash your kpekus normally with water and bye-bye. Kpekus go dey okay. But if you start to dey put all those things inside, dey wash and wash and wash, one day you go carry smell wey you no like. Oh. And do you know that there are some ladies, the reason why your husband no dey touch you again, that place dey smell. Oh. But the guy dey fear to tell you because he no wan hurt your feelings. Yes. There are some ladies, your guy no wan touch you again. He no wan knack. Because the thing dey ooze. Because you don't go scatter the place, they rub things inside. And he's finding it difficult to talk to you because he doesn't want to hurt your feelings. So I beg you, no dey put all those things inside kpekus to wash and wash. You go see people on the internet, they go tell you make you boil hot water, make the water dey comot smoke as if say you wan comot fowl feather, make you sit down on top. You go cook that thing. When you cook am and e scatter, you get problem. Now you and you go suffer. Okay. You hear me? So please don't put anything inside the abeg. I don't know why they say you should put this and this. For what reason, please? I don't know, but it's self-cleansing. The thing they clean itself by itself, eh? You don't need to be putting things inside kpekus. You make a kpekus they smell like ice cream. After that, you go tell them make you use mouth to lick kpekus. And then when they are licking kpekus, they are using saliva to put problem inside the kpekus because you don't even know whether the person's saliva get herpes. Some people get herpes for their mouths. You don't know. Herpes. Some people get other things inside their saliva. You don't know. You can't tell them make you give you head. You can't put problem in. I don't tire. Good evening. Please, what are the causes of eye turning? The video is on my page. Dizziness. Prince Peter, I have made a video on dizziness. Please go and watch it. I beg you. I beg. It's hard for me to make videos, especially when I'm the only one making my videos with no support. I beg you, Una support me. I know they be support. Una know there's be support on this internet. But now to ask me, use me and dump me. You go use me. You spit me out. So it's difficult, but I have made a video about it. Please watch it. It's on YouTube, it's on Facebook. There are many causes of dizziness. I mentioned about 15 or 20. I can't remember. I beg, go watch them. Yeah? I beg. So that make my energy and the labor where they put for this thing, make it no waste. Thank you. Don't tire. It's almost time to go. Good evening. Please, what is Staphylococcus aureus and way to prevent it? I don't do video now. I don't explain. The video is long. The video is long. I don't do video on Staphylococcus aureus. When I want Staphylococcus, pursue me. Everybody Staphylococcus, and that is how they chop you. Please. It's on my YouTube. It's on Facebook. I shared the link 2 weeks ago or last week. Go and watch it. The video is long. Person cannot explain Staphylococcus for you in 1 minute. It's long. It's about 10 minutes or 15 minutes thereabout. So please, I beg, try to watch it. Yeah. If you never share this live session, why? What can I do you? I collect your girlfriend. I collect your wife. Why you never share this video? Why? Okay. Is it normal for someone to see her flow for just 1 day? No, it's not normal. Instead of 3 or 4 days, it's not normal to see your flow for 1 day. It's not normal. The minimum is 2 days, especially if you have been seeing your period for 2 days normally. Two. Fine. But we tell women you're supposed to see your period between 3 to 7 days. 3 to 7 days. But if you have been seeing your period for 2 days since you started seeing your period, now so your own be fine. For some other women, it's between 3 to 7 days. But if you see your period for just 1 day, they're okay. They're normal. I have over 200 questions here. And I don't tire. It's time to go. It's time to go. Over 200 questions. Let me take this question from Kelechi. I went to hospital. Okay, Dr. Edward is back. I went to the hospital. The doctor said it was hormonal imbalance and polycystic ovarian syndrome. But before then, I did operation for ovarian cysts. After 1 year, I went back to scan. No cyst, no fibroid, and HSG said one tube is blocked. The other one is free. Then the guy gave me medication, injection, supplement to be taken before my menses ceased. So, this one is long, my dear. So you have hormonal imbalance. PCOS can cause hormonal imbalance. But even when your menses cease, when did the menses cease? Kelechi, when did the menses cease? Oh God, I beg. Dr. Israel, welcome back. The questions are more.
Yeah, thank you.
Welcome
network back. Now let me see road.
Bele. Whenever I'm in Africa, my blood pressure is always normal. But when I go back to the United States, my blood pressure gets high. Come on, this is funny. Because people tell you that when they leave Africa, their blood pressure, they come down normal. But when they go there for Africa, they go back up. But when you come Africa, your BP, they go normal. When you go back to US, they go high. Dr. Israel, you want to respond to this?
And it's just the environment. So it depends on what you do for US and what you do for Africa. So if you're there Africa, you are always resting, you are not doing too many things, your BP will likely come down. And maybe for US, now there you they walk, now there you they
Oh God, network. Okay, somebody is saying the stress for United States no be here. Okay, I think the stress, now the environment they cause your problem, Now that place, now US. So I think it's the environment. You are stressed. US they stress you. So when you come to Africa, you they rest. But when you go to United States, the stress. Somebody say na village people they worry. I'm not lie. No believe village people. Kelechi, my weight is 85. Please, is it okay? No, what's your BMI, Kelechi? So you have not been seeing your period for 3 months now. 3 months. What is your BMI? If your BMI is above normal, please watch my video on BMI, Kelechi. Kelechi, go to YouTube. Drop this comment on YouTube so that let me share you those videos. I beg. Huh? Ah, God, oh, time is up, ladies and gentlemen. 12-hour shift no be here. Time don't go. God, I beg. Oh. Is hot water necessary every morning? No. Unless you need it to work well. If your body works fine with it, it's fine. Okay, ladies and gentlemen. I'm asking Kelechi what is her BMI. I don't know. Okay, oh, time don't go. Francis. Sorry, oh, Dr. Israel network just they mess up. Hey, yeah. Sorry. Sorry, oh. You say make I agree to now. Ah, God. Well, can you see the frustration? To say we get Starlink now. Ah, voila. Okay. Let's see. My BMI is 29, 18.4 to 4.9. So you are overweight, You're overweight. Yes, if your BMI is 29, you are overweight. I think you should also try to cut down on the weight. Yes. Normal BMI is 18.5 to 24.9, the normal BMI. Then if you are 25 to 29.9 is overweight. Then above 30 is obese. So we have obese type 1, type 2, and morbid obesity. Okay, ladies and gentlemen, somebody sent me gift. Who sent me gift? Jesus, on TikTok. Thank you. Thank you very much. Somebody sent me rose. Money gone. Oh, Sisi, how far now? Thank you for the gift. Yeah, thank you. Thank you very much. Okay, so I have to go. It's 9 p.m. This program now every Sunday by 8 p.m. to 9 p.m. And I know vex. We have to go. Honestly, I don't tire. I don't tire. If you want to sponsor this program, send me email. Sponsor. Want to do adverts? Send me email and do adverts. Yeah. But no make no vex, I beg. It's time to go. If I couldn't answer your question, no vex. So Kelechi Esther, try to cut down on your weight. BMI, normal BMI is 18.5 to 24.9 is normal. But anything above 25, overweight. But I think you should discuss with your doctor as well. Make them help you and make them guide you. But with regards to your cyst period, I don't know. It's quite difficult, I don't know. I will try to come online later this week. Maybe if I come online, we go fit chat again. Yes. Thank you, everybody. Thank you for sharing. Thank you to the person that sent me stars. Thank you to all the people that shared the live session, and to all the people that asked questions. And if I couldn't answer your question, no vex. Sorry. We work with time here. And if you came late, sorry, you came very late. Next time, by the grace of God, we will try and answer you. Remember, I always tell you, good life now waiting. Good life now sense. Take care and have a wonderful night. Bye-bye.